Many of us have trouble spots we just like to get rid of, right? But sometimes diet and exercise won't do the trick. Joining me today with alternative solutions is Dr. Lucy LaPerna from Premier Aesthetics and Laser Center. Thank you for joining me, Dr. LaPerna.
Thank you for having me.
And you and I actually met before, but
have.
it was a different kind of procedure that we were talking about at that point, something to do with veins?
Correct. We were speaking about a procedure called endovenous laser ablation, or better known as Elvis. We like to call it Elvis. And it is a minimally invasive alternative to vein stripping.
And same thing, you still do this sort of procedure?
I still do endovenous laser ablation. We have a very active center for that. The endovenous laser ablation was kind of a springboard into these other procedures, which are minimally invasive, also done as an outpatient, but it's liposuction.
That is amazing to me. It's minimally invasive. So explain first how it works.
Well, like to the endovenous laser ablation, it works by using a very dense local anesthesia called tumescent anesthesia, where you make a very small incision under the skin, and then you basically infuse lidocaine, just a lot of lidocaine with saline, and you soften up the tissues. And then these adjunctive technologies, the ProLipo, like Smart Lipo, and the Vaser Lipo, which uses ultrasound technology, melts the fat, it liquefies the fat, and it makes it easier then to go back in and suck it out.
I was going to say, you still have to get it out, though, right?
Correct. We still have to suck it out, but you know, you've seen those TV shows where they have the real big kind of.
It looks painful.
It is. And those patients are under general anesthesia, otherwise the pain would be intolerable. So this local anesthetic called tumescent anesthesia really enables you to do little pockets of fat. You numb up the area, then you go in with a small cannula, either using the Vaser or the ProLipo, and you melt it, and then you go back in again, and you suck it out.
I like how you say melting it. And then we have some examples, I know, of some of the befores and afters and some of the work that you've done. What is the recovery time for something like this?
The recovery time is really very minimal. The following day, patients will be a little swollen, maybe a little bruised. What they feel is like they've had a real stringent workout. And so, yeah, that's a really nice example of
wow.
Vaser.
Can I just say wow?
Yeah, and that's the typical baby pooch, that women get after they've had a few children.
Yeah,
and
really?
they want to get rid of that. I know. Unfortunately, I know about that, but I can't do it on myself.
I know.
So at any rate, that's a very nice result. And it just contours that away.
And recover for something like that really isn't that long.
Really not. Really not. Patients have, as I said, they feel like they've had a stringent workout. They will have some drainage afterwards, but really not for very long, like 24 hours. And then what you see is over time, it takes actually several months to see the final result, but over time, then they just end up with these very nice contours.
You can do back as well?
You can do a lot of areas. You can do chin, bra roll, flanks, abs. You can do upper thighs.
Wow.
That kind of banana roll fat collection that people get.
I
can
love
do a lot of little.
I know. Baby pooch, banana, whatever. And sadly, I know everything you're talking about.
Yeah, everybody does. And there's just very common areas that people have a hard time losing. So
because these folks that we did the pictures of, they didn't look overweight.
Correct, and that is the population that really does best with this procedure. You don't want to target somebody who's really overweight. Mm-hmm. You want to target somebody who has a relatively normal body habitus, but they have a trouble spot. There's a lot of people have that kind of that chin that they inherited from their mother or father that is just more or less kind of an angle here. Mm-hmm. That is a very nice area to target with this. That annoying bra roll. You might have lost a lot of weight, but yet you have this piece of tissue that's hanging over your bra when you want to wear a very nice, snug T-shirt. Mm-hmm. Those are ideal areas to just sculpt away.
This has been very interesting, and I like the fact that it is minimally invasive. I think that makes men and women, right, go through these procedures
Correct.
Much more willing to do something like that. Don't you agree?
Absolutely, absolutely. And you can go to work the next day. And nobody really knows that you've had anything done.
Except hopefully they'll be able to see you in a few
Well, that's when you're in a bathing suit. Hopefully they'll know the difference.
Dr. LaPerna, thank you so much. Nice to meet you.
Thank you for having me. Merry Christmas.
You too.